Okay, this is for nasotracheal suctioning. So first we would go check the patient's chart, make sure the order is in place, and then we would gather our supplies, the sterile tracheal suctioning kit, and then we would head to the patient's room. Hello, Mr. Blank. My name is Tricia and I'm with Respiratory Care, and today we're going to do some suctioning through your nose. You have that nasal airway in place, so we are going to go ahead and get some of the secretions that may be causing out of there. So I'll use a little catheter into the nose, and then we will go ahead and get those extra secretions suctioned out. The first thing we're going to do is verify your name and date of birth. Very good. Okay. And then what we want to do is oxygenate hyperoxygenate the patient. So we have our O2 set up. And Mr. Blank, I'm going to go ahead and put a mask on so we can give you some oxygen before we get going while I get everything prepared here. And then we're going to assess our patient. We are going to get our vital signs, listen to his breath sounds, maybe feel his chest to see if we can feel those secretions within his chest here. And then we're going to keep our pulse ox on the patient at all times. We want to be able to assess that. So we will keep that on and in sight where we can see that. All right, Mr. Blank, I'm going to go ahead and get my supplies ready. So then we're going to open our suctioning kit here. And then we are going to put our sterile gloves on. We're going to try and keep one sterile hand and one clean hand. So with our kit, we have our suctioning catheter, we have lubrication, and then we have sterile saline. So we have our sterile saline within a little container that we can use, and we're going to open up our lubrication and we're going to put some onto that sterile tray there. So we have that. We have our suctioning set up. We have that at negative 120 to 100 to 120 for this adult. So we're going to make sure that that's working first. So we're going to connect our catheter here, and then we are going to put the catheter into some sterile saline. We're going to occlude the thumb port to make sure that we see that sterile saline coming back up in the catheter to ensure that that is working. So that is working. Then we are going to put lubrication on the end of this tip here. So we are going to keep or get that lubrication on the end of that tip, and I'm going to try and keep this hand as sterile as I can. So I want to keep all of that in one hand. Mr. Blank, we're going to remove the oxygen, and then we're going to get started with the suctioning here. So we remove the oxygen. All right, then I'm going to place this in your nose. You're going to feel a little bit of pressure. So I'm going to have you cough when you feel that pressure. That's going to get this catheter tip through your trachea, and then we'll go just a little bit further. So we do not want to include the thumb port, so we're going to go ahead and put that in through the air. Slowly progress that. With the first resistant, Mr. Blank, go ahead and give me a cough. Then we're going to go just a little bit further till we get the second resistance. With that second resistance, that's when we want to pull back slightly and then occlude the thumb port. Then we are going to start twisting that catheter as we pull back. We want this to be less than 10 seconds, the whole event to be less than 15. So we're twisting, pulling back, getting those secretions out of the nose, and we've completed that suctioning. So we will remove that. We will put oxygen back on the patient, and we will assess the patient. So we want to go ahead and listen to those breath sounds again, get our vital signs, kind of feel the chest to make sure all those secretions have been removed. If they have not, you may enter a second time, but you only want to enter twice. You do not want to enter more than twice for the suctioning. So you probably wouldn't want to let go of your kit, your suction catheter, until you've assessed to make sure that you've removed all those secretions, because you want us to keep that hand sterile. And then you'll assess that oxygen level. Okay, let's go ahead and remove that oxygen again. And then you're going to check with the patient, see how he's feeling, get him repositioned where he was before, and then you'll document everything that you've done. Thank you.